On this outbreak, we are joined by Kathryn Jacobsen. She's an infectious disease specialist at George Mason University. She's been on our broadcast quite a bit to talk about Ebola. Now we're shifting to another problem. Talk to me about, there's a point that the health minister has made that, last year it wasn't so bad, and that maybe the preventive measures that they should have taken and normally would take because the numbers were low last year, that they didn't really step up to the plate. Do you think that's contributing to this as well?
What seems to be the major driver is the drought. And that's a funny thing to say about a mosquito-borne infection because mosquitoes breed in water. So people are saying, well, what would drought have to do with water? The issue is that because the water supply into houses has become unreliable, people are choosing to store water when it is available in buckets or barrels outside the home. If that's not really sealed up well, mosquitoes will get in there and breed. And so not having a reliable source of piped water means that we're seeing more mosquitoes in those densely populated urban areas.
And that's the key too, isn't it? Compressing all those people together, because these mosquitoes don't travel all that far, do they?
No, they really don't. Dengue is primarily an urban infection.
Let me ask you this, how do you attack it? I mean, we just showed some people going house to house and that sort of thing, but what's the best method?
The mosquitoes that cause dengue can breed in just a tiny little amount of water. If there's so much as a little can, like a canned food item that's been left out and water's collected in it, the mosquitoes will breed there. So there has to be really aggressive attempts to try to restrict all of those possible breeding areas. What we're also looking at, of course, in the long run is the vaccine, but it's probably going to be at least another year till that's available.
Let me talk to you about, we're looking at Brazil right now, but I mean, are the conditions ripe in other areas within that region? I mean, should we keep our eyes on other potential areas where this could be a big problem?
And not just in South America. We've had lots of dengue outbreaks in the Caribbean, and we have seen some of those occurring already this year. So it's a seasonal thing. It's a big problem in lots of South and Southeast Asia, as well as throughout Central and South America.
If you're living in one of those regions, you've been hit by a mosquito, I mean, what should you be looking for?
It is a viral infection, so unfortunately, once someone's sick, there's not really a whole lot that can be done other than supportive care. The key symptoms are having a really bad headache and just terrible muscle aches and joint pain. The nickname for dengue fever is breakbone fever because people really feel that level of intense pain in their joints.
So if I'm living in a region like this, and obviously the mosquitoes are out there, is there anything I can be doing to protect myself?
Well, you can do your part to try to control the mosquito population. So watch out for the water that might be in your yard or your environment. Be using insecticides in home and have screens if you can have those in your house. But it takes a community effort to control a mosquito population.
You've been on, we've talked a lot about Ebola, and you've seen these disease outbreaks like we're seeing there. How long do you think before we'll see them get a handle on this, or is it going to continue for a while?
Well, dengue is a seasonal infection, and it's usually worst in Brazil between January and May. So we should be starting to move out of the worst of dengue season, but we'll see it again next year because it is endemic. It's always in Brazil. We just have these seasonal outbreaks. So we have to try, as you said, to get ahead of it with environmental control next year.
And pinning our hopes on a vaccine, and you say that's still a
It still may be some years away. Scientists have been working for decades. We're getting close, but there are no widely available vaccines yet.
Yeah, that silver bullet we're still waiting for. Kathryn, so nice to see you back in here. Thanks so much for coming in.